Having a great evening. I'm just hanging out here with my pony painting. Someone asked me earlier today. They asked if I were already vice president, how would I have handled the COVID-19 pandemic differently? With the understanding, of course, that the role of vice president is largely ceremonial, and ultimately I wouldn't have much more to use than the bully pulpit that comes with the position. But how would I have handled it as vice president? Well, the short answer is I'd have handled it much differently. As we now know, the White House knew as recently as the beginning of January that this coronavirus had a doubling rate of 4 to 6 days, which means that every 4 to 6 days, the number of people infected with it doubles. They knew that it could be spread exponentially from person to person without the infected person even having any symptoms, so it was nearly impossible to contain it within a small area just by screening the people for the symptoms of the virus before they were allowed to leave that area. They knew from previous coronaviruses that it could live for a long period of time outside of the body, that the incubation period, the time that it takes for an infected person to show any symptoms, could be as long as 2 weeks. And of course, they knew that this was a novel virus, which means that none of us have any natural immunity to it. And of course, that there is no vaccine, which means that if we get exposed to it, we're going to get it. In other words, they knew that this thing was nasty. And what did they do? Well, when they weren't trying to convince everyone that it was a hoax, they were keeping regulations in place that made hospitals, universities, and healthcare providers go through a months-long application process to even be allowed to test for the virus that could potentially infect all of us by the time they got approved months later for it. In fact, the only reason we even knew there were any infections in the U.S. was because of Dr. Helen Chu and others like her that we've talked about who had illegally tested patients for COVID and eventually pressured government to let them continue testing once they knew that there was an actual outbreak here. But government fought to keep us ignorant of that. They also kept regulations in place that make it harder for medical providers to work across state lines. Other regulations that severely limit the number of hours that truckers can drive every day, and other stupid rules that greatly restrict the market's ability to deliver life-saving goods and services during times of panic, including to hospitals and emergency centers. And possibly worse of all, they've continued to uphold absurd patent protections on medical devices and medications, which creates artificial scarcity and drives up the cost and drives down the availability of devices and drugs that are easily produced and have been around in some cases for decades. We just heard news that hydrochloroquine may be an effective treatment against COVID-19, which would be amazing. It's a malaria drug that's been around for nearly 80 years. Right now, it's pretty cheap. But if it turns out to be an effective treatment against COVID-19, rest assured that it's going to end up costing tens of thousands of dollars for treatments and being very hard to find because government is still enforcing patent protections on these old drugs that are easy and cheap to produce. Same with respirators and other devices that are medical devices that are easily made but are very expensive and hard to get entirely because of the patent chokehold enforced by government. So then it's obvious that government has created this problem. But how would I have handled it differently? Well, when I was first told that this disease was as dangerous as it was, I would immediately come to you, the people, with the honest, frightening truth about it. I would have explained how quickly a disease that has a 4-day rate of doubling can infect all of us. I would explain how when 20% of the infected need emergency critical care and our hospitals can only handle a small fraction of that number of patients, that will lead to hundreds of thousands or even millions of patients dying, of us dying, because they couldn't get care in time. And then I would explain how the roadblocks that politicians and bureaucrats have put in place to make it harder for us to contain this illness and treat the people who have been infected with it. See, we've gotten used to politicians and media pundits using crises such as natural disasters, economic collapses, terrorist attacks, even this pandemic, to push for greater growth of government and greater infringements on our lives and our rights. But I do the opposite. I'd use it correctly to show that government is the biggest stumbling block in allowing us as a free people to address this crisis. I would lay out what we face and then lay down the dividing line. The people in government are either on the side of ending these ridiculous restrictions on viral testing by hospitals and universities, or they're on the side of letting this pathogen spread undetected until it's far too late to contain it, like what we have now. They're either on the side of making it easier for medical providers, truckers, and others to give us the goods and services that we need, or they're on the side of shortages on everything from doctors to toilet paper and food. They're either on the side of ending these asinine patents on decades-old drugs and medical devices, or they're on the side of letting millions of ourselves and our loved ones die alone and afraid in hospital hallways around this country because there simply wasn't enough available to help them. They are either on the side of removing the government's chokehold on our ability to work together to protect each other, or they're on the side of allowing unimaginable human suffering just to retain their power. I would do what they've been doing for centuries. I would use a crisis to promote radical changes. The difference is the changes I'd push for would actually make things better instead of worse. Guys, we aren't libertarians because we think our way works, but only in ideal conditions. We're libertarians because we know that our way works to make things better in all conditions. And as your vice president, that is what I would do every single day. I would explain to the people clearly and consistently how government makes things worse and how a people set free could make it so much better. Anyways, you know I can rant all night, so let me leave you with this. As we prepare ourselves for this pandemic that didn't have to go this way, let's resolve ourselves to spread our message more loudly and more proudly than ever, so that hopefully we never have to go through something like this again. We are libertarians. We seek nothing less than a world set free. Let's show the world that. Guys, have a great night and stay safe.